All right. It is now currently recording, and I'd like to introduce you to Chris Devereaux, a gastroenterologist who would like to speak about probiotics and share his knowledge with you. The floor is yours.
Well, thank you all for coming to listen to me talk again and wanting me to come back. Uh, it's an honor. I've obviously uh, been involved with probiotics for quite a while, as most gastroenterologists are. For those of you who don't know my background, I did undergraduate at UCLA and then medical school at the University of Chicago, trained at the Navy in internal medicine and gastroenterology, which included training in tropical medicine. Uh, I've been practicing clinical gastroenterology now for 30 years, roughly. And like most of my colleagues, we've discovered a lot more about how the population living within us affects our overall health. And as we like to feel, for the better. When we talk about the GI tract and why probiotics centers on my particular area of interest. The probiotic's goal is to adjust the natural organisms that live within us. And most people consider that the colon as the main focus, but it needs to be understood that the entire GI tract has an interaction with the things we eat and the bacteria that live within us, and then they affect the body as a whole. Uh, so when we think about the organisms living within us, people don't really grasp the idea that the Human Microbiome Project suggests there's 100 trillion life forms living within our body. They outnumber us on an extreme magnitude. And there are even those who suggest that the human body is really just a car transporting around the organisms within us. And some people would argue that we're just a smart car, a Tesla, for a group of other organisms, and that they choose the color of our car and the function of our car and all the extras. And that's sort of the idea behind the probiotics, which is altering the organisms within us and their expectation for us, their carrier. Now, and this is what we're talking about. The intestinal tract has so many of these, and they are necessary for our health. They break down the food that we eat. They make nutrients available for us. And when they get out of balance, we know they cause fairly significant diseases. How do our bacterial flora get imbalanced? Well, most people understand when you take antibiotics, it's going to disrupt the bacteria that you were born with, the balance that you were given. We can counter that by obviously giving our body the proper foods to promote the right bacteria. But when you give yourself a certain fuel, it's only going to affect the right bacteria if the right bacteria are there. So people often say, well, should I do prebiotic, which is the food to promote good bacteria, or should I do probiotic, giving the bacteria itself? Well, the two are both good and actually work better. If you eat a good diet and you give yourself the right bacteria, you're going to boost the recipient of the good diet and help to balance your body flora and to push it back into balance when something like an antibiotic might disrupt the system. In extreme cases, classically a Clostridium difficile antibiotic diarrhea or something like that, where your body's flora has been completely disrupted, we will even go to the point of replacing all the bacteria in your colon if we can. And that's what people do, these fecal transplants for severely imbalanced systems. Now, when we talk about prebiotics, those are foods generally rich in a fiber that will feed the better bacteria. It's not selective, mind you, but it does favor the bacteria we like. And classically, people talk about the foods of onions, garlic, bananas, chicory root, which is a spice, and artichokes in that regard. But as we all know, healthy diet, healthy body. When you talk about the probiotics, again, those are the actual organisms that potentially live within your system, and you're trying to give an advantage to them. The list of potential probiotic microorganisms continues to grow, and it's quite vast. And we'll talk about the idea that not all of these are the same, and some of them tend to have benefits in some areas, but not in others. Where are you going?
Sorry.
Now, specifically in my area, as we said, the GI tract is the gateway for these, and the range of direct involvement in the GI tract can be diarrhea, constipation, both, as in irritable bowel, inflammatory bowel, where you're breaking down the system, uh, diverticulosis, diverticulitis, which we'll talk about, which is an interesting new area. But not just that, but the damages we do from radiation or bacterial overgrowth after surgery, or whole body effects, encephalopathy and liver disease and skin conditions can all benefit from adjusting the bacterial flora, harkening back to what we're saying. These organisms try to manipulate their environment, and we are their environment. Now, how do these things manipulate us? Well, when they're living inside us, they are fighting against potentially bad bacteria that are trying to harm us. And they can outcompete them and suppress their growth. And sometimes they'll get in the way of them trying to bind to our body and invade it to cause disease. And they essentially build up our barriers, our walls, to protect us from the things that may harm us. But even beyond that, they can release substances that will tell our immune system to do things that they like, which help us and modify our T cells and our cytokines and our inflammatory conditions within our body, which will improve our overall ability to defend ourselves.
Fair.
Then what people don't often realize, though, is sometimes probiotics can actually modify our pain perception. Most people talk about GI cramping or things of that sort. Some probiotics, lactobacillus strains, will actually have similar effects to morphine and reduce the overall discomfort and our need for other pain medications for GI-related discomfort. Now, if we're going to talk about a food, a medical food, obviously for it to work, it has to get to where it does its job. This is important because a lot of the variety and the variation in the effect of a probiotic is whether or not it has enough concentration or ability to survive the path to where it needs to work through stomach acids and bile. And why did our studies not always show a benefit? It's this variation, and we'll come back to that. The other factor about why some probiotics work and some don't is interaction with other items in our diet. Anybody who heard my previous talk knows I am not a fan of cow milk. Cow milk, I think, is a not very good form of milk as we age because most of us become lactose intolerant. Now, a probiotic that has some lactase enzyme will actually help blunt your intolerance of milk. But the vast majority of them do not have a lactase along with it. And people say, well, why can't I just get my probiotic through yogurt? I love yogurt, I'll just do yogurt. Yogurt does not survive the stomach acid really well. And it does not colonize the microbiota of your intestines very well. Furthermore, the cow milk, as we said, causes symptoms in and of itself. So when you're giving your probiotic to make your stomach feel better, you're giving it something that is trying to make it feel worse, and the two often fight. And then when you're in America, they pasteurize it and they kill the bacteria anyway. So yogurt is really a double-edged sword as a source of probiotics and probably is not your best vehicle to get the probiotics to where you want to be. Well, the part of the way to counter that, of course, as we said, is boost concentrations, such as kefir, where there's high concentration of the probiotic, try to overcome this. But it's still susceptible to that same issues of the residual cow milk and the stomach acid breaking it down. Now, the other one people always ask me about is kombucha. Now, I probably mispronounced it, but essentially, this is a tea that has sugar, bacteria, and yeast in it. This one's a bit dangerous. It's really, of all probiotics, and people argue about probiotics back and forth, this one, again, has no proven benefits, which some would argue most probiotics don't. But it has a far clearer example of risk, such as hepatotoxicity. Across the board, whether it's the American Cancer Society or GI, we don't recommend this in people who have illnesses, and it is not recommended for therapeutic purposes because of the potential side effects that are far more clearly identified. And also the fact that, as we're talking about, the delivery system, you're delivering the probiotic with caffeine, uh, acid fermentation, and such. It's just not clear how our probiotics going to survive this toxic milieu to get to our body to do what we want. Now, we're going to start to talk specifically about how to take our probiotics. And moving through these things, I know, rather quickly, but the main focus about probiotics that I hear is, when I take antibiotics, are they a good thing? Are they going to protect me? And when should I take them? And when you take an antibiotic, in a GI standpoint, we view it as scorched earth. You're just knocking everything out. And so the pharmacist or some providers will say, well, don't take your probiotic with your antibiotic. You're going to kill the probiotic. Yeah, maybe. But the idea is, the probiotic, you're replacing the bacteria with good stuff as you're killing the bad stuff. So any probiotic that survives, you're giving a leg up to the good one. Now, you're saying, well, how do you know this? Next slide. When we're talking in GI, we have our most experience with ulcers and this H. pylori organism that lives in the stomach. The worst area for probiotics, right? It's acid, it's killing everything, one would think. But actually, we found the exact opposite. We give 2 antibiotics for 2 weeks to kill this H. pylori bacteria to prevent people from getting recurrent ulcers. 2 antibiotics every day for 2 weeks. We found that if you take probiotics while on therapy, you're going to have an inhibition on the H. pylori, so you're going to suppress the one you don't want, and people have less side effects from the antibiotics that they're taking and better compliance with treatment. Meta-analysis of look at 10 trials says people who take the probiotic with their antibiotics are higher likelihood they're going to get cured, reduce side effects if they take probiotics. That's our model. That's what the GI doctor relies on when he's saying, yeah, the other studies you're hearing may not show a clear benefit, but we have enough suggestion that probiotics probably do help. And so when we come on to diarrhea, the main ones, C. difficile, which is the bad one we hope never to get, but is so common when you take antibiotics, or infectious diarrhea. We have, again, suggestions that probiotics will decrease the incidence of traveler's diarrhea and is a good thing to take as a preventive. We have a fair sense that a probiotic, taking the antibiotics in my recommendation, when you're taking the antibiotics for your diarrhea and up to a month afterwards, will lessen your side effects to the treatment and increase the likelihood that you'll rebalance your flora after. There's one other point here that comes up that wants to be made, again, about the difference between the form of the probiotic you're using, live versus dead. Live probiotic seem to have a benefit. In this case, with this, some of the studies on diarrhea, dead probiotic didn't help. And that's why when you're choosing your probiotic, you sort of want to ensure you're getting the maximal benefit by the maximal amount. And in my opinion, live is better than dead. Now, we're going to go through further GI things. We're going to do these, just touch on them, because the detail, each of these could be a talk unto itself. But when we're talking about, again, probiotics and how they affect the GI tract, balancing flora, reducing discomfort. Remember, we said it can actually modify your pain receptors. There's the further support that suggests, again, without studies that necessarily prove, we know that if we adjust your bacterial flora, we can reduce irritable bowel by treating you with antibiotics such as a selective rifaximin. We know that we can reduce symptoms in these situations. So this corresponds not just to the irritable bowel, but a more common one is we all get as older, about 40% of people will have a collagenous colitis, which is a different animal from irritable bowel, but the same concept. This is where some medication we're given or some substance actually starts to trigger an immune reaction in our colon, where the colon gets a real thick wall and we have this diarrhea that just does not go away. And often we need to treat with steroids. These probiotics, as we said, seem to protect the wall, improve our defense system from these sort of chronic diarrheal illnesses. And then you go a level higher, you go to actually inflammatory bowel disease. Suggestions again, we're changing what our immune system is seeing from our GI tract, making its response, its over response in the case of an ulcerative colitis or a Crohn's disease, we're making that immune system down regulate. But people argue, you go to your GI doctor, they don't want to really commit to these things because it seems an uneven response. And that harkens back to the ideas we know there's a benefit, but the benefit is going to depend on the factor of how you're delivering the probiotic, how much you're delivering, whether you have other factors that are going on. And in a complex system, this is not the only treatment that it's difficult to clearly demonstrate a benefit in isolation. And remember that because we'll come back to isolation versus as an additional treatment. Now, we just talked about diarrhea. I said, okay, well, it's for diarrhea. Yeah, but it's also for constipation too. The constipation actually has more clearer suggestion of benefit, that it'll improve your frequency, your consistency, your transit time. You make the bowel happy, the bowel works better. The one trick about constipation, though, is it will drop the gas pressure. And in some people, your stool will improve in consistency, your frequency may improve, your transit time may improve, but you'll start to back up gas because you're making a tighter seal of the stool going out. And that's where the idea, again, that probiotics work sometimes, but they need to work in combination with other factors, hydration, exercise. When it comes to diverticulitis, which is real common, in my mind, diverticulitis is just an offshoot of constipation. Increased colonic pressure, creating these little pockets in the colon. That's what diverticulosis is, the pockets. And they get infected, much like, as I said in my previous talk, they're zits of the colon. The bacteria get trapped in those holes. So diverticulosis, we talk about the range of just being there to causing pain without infection, to causing pain with infection. All of it hinges on cleansing, hydration, keeping the colon clean, and the bacteria that are living within it. So more and more, there's a suggestion in people with chronic pain or recurrent diverticulitis, a probiotic. In other studies in Europe, even probiotic with a little bit of steroid to drop the inflammatory process of the colon will break people out of diverticulitis episodes and break them out of chronic pain related to diverticulosis. And very interesting aspect also, again, as we're saying, I keep coming back, the probiotics, the bacteria in our intestine are manipulating our whole body in some way. One of the ones that seems to be clearer as time goes by is that eczema, a very common allergic dermatitis, and can be modified by probiotics. And more meta-analysis seem to suggest that if you take a probiotic, your eczema may reduce by as much as 21%. Comes back again, though, that each person has to sort of find their probiotic that their body likes, but they'll often have suggestions that you can talk to your dermatologist about what they think. And when we talk about other foods that irritate our system, celiac disease, complicated disease, but probiotics seem to have a role in breaking down the gluten. If you break down the gluten into smaller fractions and digest it and pre-digest it, more and more studies suggest that you're less likely to cause a reaction should you get an incidental exposure to gluten. We would never suggest you take a probiotic and eat gluten, but the probiotics appear to help protect your system and reduce your reactivity to the gluten. And when we do damage to our system, radiation, we get radiation to that cancer in our abdominal area. It hits the bowel, usually by accident, or it may be the target. More and more, we know that the damage of the radiation to the intestine is a factor of what's living inside you, the intestinal bacteria. And we do have a suggestion and sense that a use of a probiotic can lessen that. And as we identified when we talked about treatment with antibiotics in H. pylori and other infectious causes, it tends to reduce the side effects, the nausea, the disordered contractility. So it's often useful to people who are undergoing treatment, radiation, or chemo to use probiotic if used correctly and with discussion of your cancer specialist. Now, bacterial overgrowth is everywhere. Everybody thinks they have bacterial overgrowth. The bacterial overgrowth, remember, is something you really have to talk to your doctor about because bacterial overgrowth requires an abnormal uh, uh, structure of the bowel, something that has affected the motility to allow the bacteria to grow up. But the whole concept of cleansing your system, keeping the hydration, keeping things moving through, and replacing with good bacteria, that part, it may not prevent the SIBO in somebody who's got an abnormal bowel, but they do know it's going to reduce the bacterial breath hydrogen concentration, the abdominal pain. There is going to be some benefit as an additional treatment, especially if you're trying to do an antibiotic course for your SIBO. Having the probiotic along, I think, is a great idea. And I put this one in because the idea is, again, I'm trying to emphasize, we know probiotics help GI. We suggest it helps other parts of your body. This is a situation where we know that bacterial flora directly affect thinking. This is, of course, an isolated case. Hepatic encephalopathy occurs in liver disease, but we know the bacteria in your gut will produce substances that affect thinking. By projection, probiotics are known to help this. There are many of us who think good gut health makes good brain, whether it's hepatic encephalopathy or some other form of difficulty with thought. That's got a long way of a lot of studies to prove, but it's something that has very low risk and potential benefit. I often encourage people to use probiotics in this situation as well. Now, when it comes to products, the biggest question I get is which one to use. I've hinted at this. Now I'm going to be more clear. I like live probiotics. Why? Dead things I don't think are going to be able to really make a difference. So I tend to lean towards powder forms, and I tend to lean towards high concentration. Of those, VSL number 3 has actually had the most success at showing a difference. VSL 3 is the one that got me to get away from my prejudice when we were treating Clostridium difficile, colitis, because I had people on it and then I diagnosed them with the bacterial infection and I called them. I said, oh my gosh, we got this bad bacteria. And they said, I'm already feeling better. And I go, huh? I haven't done anything yet. The probiotics seem to blunt the symptoms. That's anecdotal. But 30 years of practice, I find I give them the probiotic, they feel better. I then get rid of the bacteria. We win the battle a lot easier. People say, well, I can't get VSL number 3. Well, you can again. It was a court case. VSL number 3, the person who created it, made a new product, VisiBiome. VisiBiome and VSL did not like each other. They have settled their disagreement, and as I have been able to obtain both products, but I consider them both achievable. But if I'm looking for a probiotic, personally, I look for a powder and I look for high concentration. Now you say high concentration. Well, here's a wide range of dosing. I'm not going to read them all, but essentially the principle here is there is never too much probiotic. What we're talking about is cost. This is a food in general, and people can take up to 8 packets of probiotic a day. Is it fun? No, but if you don't mind it, sure. And I mix it into something with flavor, and instead of just straight water to make it go down easier. But realistically, it's a lot of things that we do in the GI tract that your doctor may not make clear. It's a titration to effect. So in the case of a probiotic, you take what you need to get the job done. In our opinion, it's not going to harm you. And when we talk about safety, lactobacillus is the main one that's in VSL. There's no dose adjustment for kidneys, no adjustment for liver problems. Realistically, the only adverse reaction was bloating and flatulence, but the vast majority of probiotics improve that. So we're not clear how that got to be our main adverse reaction. The one question people bring up is immunocompromised patients. There are rare case reports of somebody who was on a probiotic who was immune compromised, that bacteria seemed to cause an infection within their body as their defenses were down. My counter to that is, yeah, well, there were a lot of bacteria in there. And if you've got all these choices, once in a while, one of the good ones might take advantage of you. But that percentage is so low and the benefit's so high that I actually do not have issues with people taking probiotics when they're immunocompromised. I leave the final decision, though, to who's making you immunocompromised. So if it's your oncologist, you talk to your oncologist. If it's your neurologist, you talk to your neurologist. Say, hey, I'm interested in taking this. What is your opinion? Most of my colleagues actually say, we would rather you take this because it will reduce your GI side effects. It'll help keep your bowels regular, improving my ability to treat you for what I'm treating you for. And when we talk probiotics coming back, as I said, why are we not getting a clear response? Why, when we give probiotics, why do they say unproven? It's complicated. The bowel is complicated. There's multiple aspects to it. And for this to work, it's not going to be your sole treatment. You have to take responsibility for the whole system. Hydration, lots of water. If you've got a slimy pipe, you're going to run the hose through it, wash the slime through, water washing it through. Then when you put in the nice smelling stuff, it'll work because you got rid of the bad stuff. Swimming, whole body exercises. And when you can't swim, yoga, Kegels, improve your pelvic floor, your muscle strength. So the muscles of the bowel and the pelvic floor can contract stronger. They can push things forward better. That motility combined with cleaning out the area and replacing it with good things, that's how you're going to get a more consistent response to any intervention that you do. And when it comes,
Oops, sorry.
So when it comes to conclusion, several probiotic preparations have promise in preventing treatment. We have a sense this helps. Those of us who do this for a living believe it helps. There is variation. The variation occurs because there are so many products, how people take them, what other things they do in their life. It can't do it alone. It's a whole body process. This is one aspect of what you can do to make yourself feel better. The enthusiasm for probiotics outpaced science and hence confusion. This happens in new treatments all the time. As better trials come forward, I believe the probiotics are only going to continue to establish themselves as a very useful treatment for us. Right now, though, it comes down to cost versus benefit. If you have the economic ability to use it, there's really not much of a downside. But the FDA has not approved it and the insurers aren't paying it. So you can sink a lot of money into probiotics. Each person has to sort of determine, is it economically viable? Do I get enough benefit from its use to warrant me paying for it? But in situations where you have chronic GI issues and immune issues, I advocate trying it because it often, in my mind, even though you're buying it yourself, is still a very effective treatment, low risk, at a reasonable cost. And should I use it? Well, the decision rests on, as we're saying, anticipated benefit. Do you think you're going to get a benefit? What are your alternatives? It is the particular thing you're aiming to use it for. Has there been a suggestion there is a benefit? Can you afford it? And do you like probiotics? But always remember, no probiotic strategy is considered to represent the standard care or primary treatment. It's a helper, and that's where its strength is. If you're relying on it alone, you're probably not going to get the full response that you want. At this point, that was rather quick, but is there any questions that are on the chat that we'd like to
So,
go through?
so this is more of a specific, thank you so much. I
Mm,
know that was a broad scoping overview, and I know we don't have lots of questions.
mhm.
So this was a specific question regarding a specific product by a genomic company where you send in the stool sample and then they create a probiotic especially for you. What are your thoughts about that? And I'm going to just stop sharing right now.
The trick there is there's a lot of companies, mainly it seems in Texas, who make a lot of money out of people tailoring products, doing genomics, doing GI allergy tests. The problem there is there's not a lot of control over them. And there's a lot of variability on what they're doing. The concept, sure, concept seems good, but I haven't found their results interpretable. I can't figure out what to do with what they're saying. And as my allergy colleagues like to point out time and time again, a reaction to a food is more important than a positive test. I'm going to say that again. You go to the allergist, and I send them to them all the time. They come back. He said I reacted to cantaloupe, nuts, beans, whole long list. I've been eating them my whole life. They don't cause an issue. And then we go through it, and I say, what was the next thing he said? He said, of the ones that are positive, separate them out and introduce them one at a time. If you notice a reaction to that food in isolation, then stop it, see if you get better, and reintroduce it. They want to connect your symptoms to a potential reaction. What if you're not careful and you have one of these studies and such, they're going to have you eliminate way too many foods, which may potentially increase your reactivity to that food because your body may be dealing with its overreaction to it. And when you select what you think is the most important probiotic, you may be missing an interaction of the helping of these other strains to the one you want. The balance and complexity of the probiotic is its strength because you don't know what your body may need to fight against. And I don't think that company does either.
So you don't recommend those.
Don't recommend wasting the money. If you got the money, have a good time. But realistically, I would probably pick a good solid probiotic, try it, and adjust it and try and figure out if it helps you rather than paying somebody a large sum of money for a specialized product. Now, I'm going to go on a tangent right now because that brought up another point. When we talk about probiotics and the foods you eat and the prebiotic, there's a new aspect of diet, which I talked about on the previous talk, and I'm going to say again, ancestral diet. What do I mean by that? Your ancestors, where you came from in the world, they ate certain foods. Those foods your body evolved to like. Your ancestors would choose foods that didn't upset their stomach. So whenever you have GI issues, I tell people, what's your main ancestry? What kind of flour did they use there? What kind of vegetables did they eat there? And then I said, that's a good starting point. When you ask me what food should I eat, look at what your ancestors ate for generation after generation. Start there, supplement with your probiotic, hydrate, do your exercise, and you're more likely to get a quicker response and a more lifelong response.
Maybe that's why I gravitate towards Indian food.
Yes, and people often
Uh,
discover what they call comfort food from when they were a child. Well, most of us understand the comfort food was family food. It was what the family ate, what the mother was taught to cook by her mother, and when you got sick, they would bring out the family remedy. Well, the family food remedy usually is an ancestral food.
So another question in the chat box. Can you get live probiotics from like grocery stores or health food stores as a basic system support? Like
Well, the VSL number three,
here.
Visbiome, they're sold at Costco and Walmart. Now, the trick that happens is live forms, you'll notice, have to be protected from light. So a live form of probiotic will often have a dark packaging to prevent light from going in and killing it. And often it's refrigerated. So you would go to, let's say, a Costco or a Walmart, you try to get an over-the-counter Visibio, and you can't find it. That's because it's in a refrigerator behind the counter of the pharmacy. It's not a prescription. There is prescription strength, mind you, that sometimes can be covered, but it's there because it has to be refrigerated. So sometimes you have to look around. But you have to be careful again with your product choices. And this is where I'd say you should talk with your doctor and sort of remember that not all probiotics are the same. And you have to do your homework when you're choosing. I have my bias. I keep coming back. BSL, Busy Bio, those are my two favorites, my go-to. But that doesn't mean some of the others may not be beneficial. And the things I look for are live, powdered form, high concentration.
Um, can we just look at this list? Um, and some of these are chewable, some come in gummy forms, some are just sitting on a shelf. Um, so how's a person to choose? I know you like the VSL and Visio Bio, but many people are doing well with some of these other products.
True enough. And that comes back to each body's different. And although I feel live is more likely to provide a benefit, studies do say some of the dead ones do provide benefit too. And that adds to the confusion and why each person has to titrate to effect in themselves. What am I saying? You got to test it on yourself, see how much your body likes and what response you're going to get. I rearranged that list to show the top four, the ones I have in my office. My bias, BSL, Biome. I actually have a Lion and Floristar. I have no problem with any probiotic, but I'm going to repeat again and again. The ones I like are alive, hence they need to be protected from light, and they need to be refrigerated for maximal benefit, and they have a high concentration. Gummies and pills tend not to have a high concentration. They tend to be dead. I'm not a huge fan of them. But if they help, sure. Some people don't need that much to survive the acid bath of the stomach. But it's sure a lot easier when you've got a lot more trying to sneak through to get through the defenses. Now, one aspect that you all are raising is, well, I'm traveling. I won't have access to a refrigerator. That's where a pill form is going to be better for you because they are more heat stable. You should keep them out of direct sun, but they are far more likely to retain their benefit when you're doing your trip through Europe. Now, powdered forms can survive a plane flight and then be thrown in the refrigerator in the hotel when you get to the other side, but you may want to hedge your bet and have a little bit of both.
There was a question about cancer that I'm going to save to the end, but I'm regarding just this topic of types and times to take it. What about acidophilus that's sold refrigerated at our grocery store, like at Boney's?
Right. The problem with most of the acidophilus liquids that I've seen is they are in cow milk, and hence the acidophilus milk. The acidophilus is an additive to a milk usually. Hence, it comes back to my previous comment about be careful about anything that is in milk or a milk protein, because it seems, in my experience, to counter the effect in those of us over 50. and because we all are going to be lactose intolerant. I don't care if you're from Wisconsin. I don't care if you drink milk every day. Sooner or later, you're going to have lactose intolerance if you're a human in America. And it's going to be subtle, but cow milk seems to get in the way of probiotics by feeding the wrong bacteria and countering the effect. So that's my one drawback on it. Look and see what the carrier is in your probiotic and see, what they're giving you along with it, because it's those other factors that ruin all these studies and say, well, I can't show a clear benefit. Yeah, well, they gave it to it in yogurt, or they gave it in milk. They gave it in a cow protein. So their good effect was blunted by their bad effect.
How about if you take this is an interesting question. If you take a probiotic prophylactically just for regular maintenance, will that change your response to future antibiotic therapies?
No, but it will potentially have your bacterial flora stronger. Antibiotics are going to screw you up. The idea of the probiotic is to give you the chance to be more resilient, to spring back. You take probiotics so you've been working out in the gym. Your colon is buffed. It's the Arnold Schwarzenegger of colons. And somebody throws some antibiotics at it and they say, no, yeah, really, that's not going to bug me. But the antibiotics are still going to try it. And so, as I said, I boost my probiotics when I'm on antibiotics. I don't leave my strong colon to fight the battle alone. I help it. And I always take my probiotics daily for 1 month after a course of antibiotics, because that's the window you're going to get Clostridium difficile, antibiotic-associated diarrhea. And so I take my probiotic on it and a month after to give my strong colon every help it can get.
When's the best time to take a probiotic? In the time of day?
Food. Probiotics, food. So put it in juice and take it with food. The acid's busy digesting the food. The probiotics can hide, slide on through. That's my opinion. I wouldn't do it on an empty stomach. You want it to go down there, and also when it's feeding time at the zoo, obviously all the bad bacteria are going to town. You want the good bacteria to already be there too. So all your food hits the colon with a whole bunch of probiotics. The probiotics is going to take its portion and it's going to keep it from going to the bad bacteria. Part of what you're doing. Prebiotic food, you're feeding your bacteria. Probiotic is the actual bacteria you want. The more of them there getting a bigger share of the food, the less for the bad guys, the more likely the good guys are going to grow stronger and take a bigger control over your intestines. You're always going to have bad guys in your colon. Almost all the infections we have live in you. They cause you a problem when they get an advantage. So we want always to give the advantage to the good guys.
So I think it might help because I recall when learning about what the content of our fecal matter is.
Mhm.
It is mostly dead bacteria, right?
Live and dead.
Dead, right? So
Because they
what?
outnumber us on an order of magnitude of, like I think they said 1 million gut bacteria for every cell in your body.
So
They totally outnumber us.
so it's important for us to understand, like, if you have like 6 inches of poop, what percentage is bacteria?
A lot of it.
Like,
I don't have an exact figure, but the people say, well, I didn't eat, yet I still poop. Why? Because these bacteria are turning over in your colon and dying and sending their bodies out and so your poop continues to come just from the cell turnover of your bacteria and the shedding of the skin lining. Everybody knows you shed your skin outside, and that's part of what, dust mites in the bed and all the rest. Your colon lining is turning over continuously. The skin there is dropping off. So your stool, a large portion of it is the bacteria, then the skin of the colon, and then what's left over from your digestion. Left over, meaning your body's doing everything it can to suck all the good stuff off. And so the stuff, the percentage of fecal matter that is there is the inert leftover food coming along with your own cells and the bacteria mainly. And I'd have to ask a scientist who goes through these things to determine it. But certainly, it is not hard to find bacteria and parasites in stool. That's what a lot of people do for studies.
Yeah, I think it's about, it's at least over 50% of
I would say
60.
more than
Okay,
half,
yeah, more than
but
half.
I can't give you an exact figure because I did not look that up.
And then the VSL3 capsules, is that considered a powder or is it the packets
The
that you're talking?
packets is the powder. The VSL3 capsules are the more heat stable version, and they're easier to carry around. I have used VSL3 when I travel capsule form. I use it when I'm in the office. I keep it around because I don't have access to a refrigerator just like everybody else. But if you said, what do I really like? I take the powder, I put it in juice, I drink it with my meal. I think that really is the better form. And if you look on the packaging, you'll see it's billions of colonies more in the powder form than the pill. I do believe that makes a difference.
And they've hiked up the price of the packets for sure.
Oh, yeah,
Um,
what the market will bear. That's why we say cost benefit, what you can afford, and that's why you test it. And some people say, "Well, I found that I feel really good on the probiotic. Do I have to take it every day?" I said, "Try it every other day. Do you still feel good? Sure. Try it every week. Do you still feel good? Yeah." So the idea is the only time I really think you need to necessarily take it every day is when you're getting assaulted by the antibiotics and right afterwards. That's your big thing. Or when you're traveling in that country where you're not so sure of the water supply, take it every day. Because one thing that's clear is probiotics are probably as good as prophylactic antibiotics for traveler's diarrhea. Now, that's a strong statement. Somebody will probably come back and hit me for that one. But the reality of it is, there are studies that support that. And so you're better off doing a probiotic than taking antibiotics every day of your trip.
and we did that with our own child, and he was out of 20 kids.
Oh,
Yeah.
yeah. Well, this is a great story that my wife brings up. My son did a project in Ecuador. They went down there to build a school in the Andes. And they went to the village, and these were all high school kids, healthy, young high school kids. We're talking strong colons here, strong stomachs. He took VSL probiotic the entire
Every
time,
day.
didn't miss it. He and one other child who was also doing the probiotics were the only two children out of 20 who did not get a severe viral traveler's diarrhea. And when I say severe, two of them were admitted to the hospital and could not fly back. My son, though, he was constipated. He had to go ask, can I get some Miralax to help my bowels? And he had to explain to the teacher, no, I know how to use the product. My father's a gastroenterologist. I'm sorry, I didn't get diarrhea like everybody else. I got the other problem. So anecdotal, true. But in our own family, here, everybody else is stuck in the room with diarrhea and my son needs to get a laxative. There you go.
So, and let's, for our final question, talk about the one that's just a little side topic, is the incidence of GI cancers in the 30 something year olds. 30, you even have commented that
Oh,
younger
God, yeah.
people are getting it. And even if they ate healthy and
The
had
youngest, right, right.
probiotics, what
The
do you think?
youngest person I've diagnosed with cancer is the youngest person I still see, 18. And they came in with an asthma attack, had a spot of blood in their colon. And anytime you have blood in your colon, it requires a discussion with a physician. And if you've not had proper colon check, of course, I'm a gastroenterologist, go get it checked. This young 18-year-old active duty recruit with an asthma attack, I sat at the bedside, said, really, we should take a look. We looked, we found his colon, had a cancer right there in the rectum, 18 years old. Only symptom was blood in his stool. So the idea there is cancer happens in young people. Do probiotics play a role in cancer development? Honestly, no. They're not going to protect you from that, especially in a younger person. There are so many factors involved. A healthy colon, yes, you're potentially going to reduce toxins potentially from bad foods, but really it's the bad food toxins that are a factor. Barbecue, chemicals, things like that that are going to be more likely. A probiotic is more an immune modulator. It's affecting your immune system. And so the complexities of cancer development, I really am not the person to go into, and whether, the infectious component. But honestly, your goal with a probiotic is to make you tolerate treatment of your cancer better, where your chemo or radiation alters your bacterial flora, boost your immune system so you do not get an infection in your body that's preventable. And, I would throw in, again, I got tangential, but the idea of improving your body chemistry such that your pH is better balanced, hence its effect on skin conditions. Some people argue female yeast infections, even, urine issues, that probiotics may help change the flora for the better in all of those surrounding areas. I think of it like, obviously, living next to a trash dump. If the other body structures in your pelvis are living next to a big sewer treatment facility. So obviously, if the colon is better taking care of its bacteria, the neighbors around there are going to be happier too.
And that's all the questions that I have for that in the chat box. I'm going to stop